welcome to the Diabetes Bowl, the first and only game show which tests diabetes knowledge. Today's contestants are Tyler, a type 1 diabetic, Bob, a type 2 diabetic, and Stacy, a graduate nursing student. Welcome, contestants. Today, all our questions will be related to Biguanides. Let's get started. What is the only medication in this drug class?
Metformin, which is first-line treatment for type 2 diabetes. The brand name is Glucophage or Glucophage XR for extended release.
You mean that all of these questions are going to be about type 2 diabetes? This isn't going to go well.
Correct. That's 100 points for Stacy. What is the effect of metformin?
Metformin is an anti-hyperglycemic which can reduce hemoglobin A1C by up to 1.5% by reducing fasting and postprandial blood glucose levels. It can help with weight loss and it has a positive effect on lipids.
Correct again. That's another 100 points to Stacy. Look alive, fellas. Question 3 is about pharmacodynamics.
The mechanism of action of Biguanides is to increase peripheral glucose uptake, decrease hepatic glucose production, and decrease the intestinal absorption of glucose.
Someone's been doing her homework. Are your buzzers working, guys? Our next set of questions will be about pharmacokinetics.
50 to 60% of metformin is absorbed in the GI tract when taken on an empty stomach. The plasma half-life is 6.2 hours, there is no hepatic metabolism, and it is excreted unchanged in the urine.
Well, that was like the next 4 questions, but you only buzzed in one, so we'll give you 100 points for that lengthy answer. Moving on. Are there any precautions or contraindications with metformin?
Metformin should be used with precaution in the elderly due to decreased renal function, and it should be held prior to iodine contrast studies. Use of metformin is contraindicated in the presence of renal disease or in metabolic acidosis, and breastfeeding mothers should not use metformin.
Correct again. That brings your total to 400 points. What are the adverse drug reactions associated with Biguanides?
I know this one. I've been taking metformin for about a week now.
Bob?
Judge's rule?
We'll accept that answer. The most common side effects of Biguanides are GI upset, including bloating, diarrhea, nausea, vomiting, and metallic taste. Sounds like a lot of fun. 100 points for Bob.
You can take your metformin with food if it causes GI upset, but it should resolve in about 2 weeks without a change in medication.
That wasn't a question. No points awarded. Someone check on Bob, please. The show must go on. Does metformin have any drug interactions?
Cimetidine and furosemide increase peak plasma levels. Digoxin and vancomycin increase the risk for metabolic acidosis, and you should not drink alcohol when you use metformin.
Great. Right again. Let's get on to the questions about prescribing.
I'd start my patient on 500 milligrams of metformin twice daily. I'd make sure to monitor their renal function and their hemoglobin A1C. I'd make sure to educate them that they can take the medication with food if it causes GI upset. They should take it at the same time every day. I'd make sure they know the signs and symptoms of hypo and hyperglycemia, and I'd educate them about increasing their exercise, their water intake, and their intake of healthy food.
Well, looks like you summed that up for us well. That 100 points bring your total to, well, whatever. You're in the lead. Welcome back, Bob.
Thank you.
Time for the bonus round. Each question correct is worth 1,000 points and everyone plays. Contestants, please write down your answer to this question. What is the most important thing that people should know about metformin? And we'll see what they've answered after a brief word from our sponsors. Oh, I'm getting word that we have no sponsors. So let's see those answers, contestants. Everyone is correct, and everyone's a winner when we learn more about diabetes management. I hope you enjoyed this first and possibly only episode of Diabetes Bowl.